Good evening and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese Willis. I'm your board-certified family medicine physician. I assist busy professionals to find healthcare solutions for both their acute and chronic medical needs. I'm also the CEO and founder of Dr. Celeste, MD, and I do that through my virtual medicine program as well as my concierge medicine program. I'm also a brand new Amazon best-selling author to my brand new book, Vitality. So good evening and welcome, ladies and gentlemen. This is our COVID-19 update. Today is April the 17th, 2020. Hi, Ms. Tate. Thank you so much for joining us. So we're going to be talking to you guys today a little bit about COVID-19 in asthma patients, in diabetic patients, heart patients, and then we're going to talk and go over some pharmacy considerations. So let's just jump right into it. You know that we've been following the COVID-19 virus. It is the novel coronavirus, and novel means new. That means that it's a new virus that our bodies have never seen before. In fact, they haven't ever seen them before. That's why they call it a novel or new coronavirus. Hi, Ms. Harris. Thank you so much for joining us. This is a virus that was first diagnosed in Wuhan, China, back on January the 7th of 2020, and we've been following it since then. It was first believed to have been started in a seafood market that sells both live and dead animal products. So it has made its way, and it has definitely shown its head to be deadly viral pathogen. So what we're doing now is just going through a few things that you guys may find helpful, especially with the recent things in the news about the disparities between African Americans and the large rate or percentage of people that are African American that are having a lot of complications, including death, as a result of COVID-19. So we're hitting on these topics today in the hope that we can help empower and encourage some of you to mitigate the risk of you obtaining or getting COVID-19. So let's start off first talking about our asthma patients. If you're out there and you're an asthma patient, most times people that have asthma, you've discussed with your physician and you have what's called an asthma action plan. And that is something that we put together for our patients, wherein we kind of plan and try and prevent asthma attacks, and we put them on a regimen or a maintenance of medications and a maintenance of things to kind of do at home to help decrease the likelihood that you'll have an asthma attack. The purpose of this is to kind of help keep your asthma under control. So you want to make sure that you're continuing your current medications, including your inhalers, unless your personal physician has told you to stop them. It's very important to make sure you know how to use your inhaler if you've been given a diagnosis of asthma, because you don't want to be learning how to use it when you're in a position where you need to learn how to use it pretty quickly. So you want to make sure if you have asthma that you know how to use your inhaler. There's typically a package insert with the inhaler that you get from the pharmacy that can explain in very detailed instruction how you are to use this. If that does not help you, then make sure that you contact your physician right away so that you can get some more instructions on how to use it if you don't know how to. You want to make sure that you're avoiding any triggers of asthma for you. Everyone has different things that they are allergic to. A lot of people are fortunate and blessed enough that they're not allergic to anything, but typically people that have asthma, there's certain things that trigger their asthma or cause them to have an asthma attack. So these are things, guys, that you want to make sure that if you have asthma, that you're avoiding those things. The last thing we want right now is if you have asthma, for you to have some kind of asthma attack or have any respiratory issues at all. So we're trying to keep things at baseline as best as we can to decrease the likelihood of even having to deal with any complications or even getting COVID or putting yourself in a position where your lungs are fighting harder, your immune system's fighting harder. One of the ways that we do that is controlling the asthma attacks, and that means avoiding those triggers. So let's talk about some of those triggers. A lot of people are allergic to different things. Most people that have asthma know what triggers them. For some people, it's pollen, and the pollen count has been high lately. For other individuals, that can be trees, it can be pet dander, it can be tobacco smoking, it can be cockroach dander even, it can be mold, as well as different foods that trigger allergies in patients or an allergic reaction in some patients that have asthma. So you want to make sure that you're avoiding these triggers. Now, let's go to cleaning. If you are in a home wherein there's more than one person in the home and they don't have asthma, what's great is for that person to actually do the cleaning. especially if using any kind of disinfectants. There's some disinfectants that trigger asthma attacks in some patients. So if you are an asthma patient and you know that, hey, every time I use this cleaning solution, it causes me to have an asthma attack, very important for you to avoid doing that. If you live at home alone and you're trying to clean, you just want to make sure that you have a mask or a mouth covering of some kind to prevent you from inhaling any of those disinfectants that could trigger asthma for you, okay? So for our asthma patients, we're going to make sure we have that action plan together. If you don't have an action plan together, I encourage you to contact your physician and make sure you get that together. If you can't get in touch with your physician or in need of a telemedicine consult, you can schedule a consult with myself or there are a lot of physicians out there doing telemedicine now, because that is one of the complications of dealing with COVID-19 and with the quarantine right now. So make sure you have that action plan ready and in place so that it's there, so that if something happens, you can utilize it instead of having to figure out what to do, okay? So second condition we're going to talk about, and we're sharing this with you. These are some things that the CDC has shared in the last 48 hours about things that are important to do for people that have certain conditions. We touched on this a little bit last week in talking about if you have heart disease or if you have asthma or if you have certain chronic conditions, that it's important to make sure that your maintenance therapy is up to par and that you have everything that you need. So we're just expounding on that a little bit. The CDC put out some more information today with specific details that they're recommending for people with certain conditions. And so that's what we're sharing with you today. So if you're out there and you have any kind of heart condition, and you remember we talked about this last week, if you have a history of coronary artery disease, if you've had a CABG or had any kind of heart surgery or stents placed or any kind of blockage, all of that, we consider that to be coronary artery disease. So you fall into this category. If you have heart failure, if you have any kind of congenital heart condition, if you have pulmonary hypertension, very important for this group of individuals to make sure that they're regularly taking their medicines and that they have at least a 2-week supply of their medications right now. You want to make sure also that you're monitoring your blood pressure. And a lot of people have asked the question, well, Dr. Celeste, why is it such a big deal, or why is it that we're seeing some of what we're seeing in patients that have heart disease? What does heart disease have to do with my lungs? Because I thought that COVID just affects your lungs. You mean it can affect my heart? And the answer to that question is definitely it can affect your heart, and this is how. Now, when someone suffers with COVID-19, some of them inevitably experience some damage to their respiratory tract, and your respiratory passageway, your lungs, is the mechanism by which we get oxygen exchange and that we drop oxygen back off into your bloodstream. So your heart does a great job with the way that God made us of pumping blood to the rest of your body and your organs and everything else. So whenever you have a situation or anything that compromises your lung function or compromises that ability for your body to pick up that oxygen, then it can affect your heart. And the COVID-19 definitely affects the way that your lungs work and how the exchange of oxygen, or it can affect it in some patients that are symptomatic, I should say it that way. So when you have COVID-19, and it affects your respiratory tract, your heart is working much harder than it typically does, and that is what can lead you to have worse COVID-19 symptoms, and unfortunately in some people even trigger some patients to have a heart attack or even a stroke. So that is why it's very important for these patients to make sure they're continuing their maintenance medicines. And I want to just take a page right there and make sure that we include people that have high blood pressure, because when your blood pressure is uncontrolled, hypertension is a silent killer, but when your blood pressure is uncontrolled, it puts you at risk for having a heart attack or a stroke. And we definitely don't want you to have to deal with any complications such as that at a time right now. So taking your blood pressure medicine, making sure it's controlled, making sure you're on your regimen, your heart regimen if you're a heart patient, will also aid in that way. So let's move on and talk about people that have diabetes, okay? So for our diabetic patients, you want to make sure that you have plenty of your medication. If you're supposed to be on insulin, make sure you have plenty of that. Make sure you have a 2-week supply at least of your diabetes medications. If you're supposed to be on insulin or on meds by mouth, I encourage you to take those. You want to make sure you're keeping a blood sugar log. Most physicians will encourage their patients to make sure that they keep a blood sugar log where you're checking your blood sugar at home. Checking your blood sugar at home every 4 hours is a good idea for people that are diabetic, that are accustomed to checking their blood sugar and keeping a log. The reason why you want to make sure you keep a log is so that you know at first glance, hey, my blood sugar's starting to get under control, because sometimes when people start to get sick, one of the first things that happens is their blood sugar gets under control. And we'll go into that a little bit more in just a minute. For these patients that are diabetic, you want to make sure that you have at your home some of the things. You want to be prepared just in case you get sick. So let's talk about some of the things that we have at our home when we're sick that we use to kind of help rehydrate us. The milder foods that are less harsh or easier on your stomach, like soup, like gelatin, like crackers. You want to make sure that you have juice boxes also in case you have a drop in that blood sugar and need to take in something by mouth that has sugar in it, okay? So you want the juices only for that particular instance if you're diabetic. Now, as I said before, if you are diabetic and you get sick, it can become more challenging to keep your blood sugar under control. As a matter of fact, a lot of times people, when they get sick, their blood sugar starts to go up. Now, in addition to that, if you're having nausea, vomiting, and diarrhea, you're not going to be able to eat, right? So if you're not able to eat, that can affect your blood sugar levels. So if you're not able to tolerate anything by mouth, you may have to drink some drinks that have a little sugar in them if you're not eating, to try and make sure that we keep your blood sugar up. So one of the things I encourage diabetic patients to do, definitely keep that blood sugar log. We already talked about that. Make sure that you have a thermometer, and make sure that you have a scale so that you can weigh yourself, because there are a few warning symptoms that we typically recommend for diabetic patients that if you get to this point, then we know that you need to seek emergency care. So you want to make sure that you're not stopping your meds and not stopping your meals. You want to make sure you stay hydrated with low-calorie liquids, including water. The times that a diabetic patient should go to the emergency room if they are sick is if you get to the point where you're having problems breathing. If you can't breathe, then definitely you need to seek emergency medical attention. Secondly, if you cannot keep down liquids or foods more than 4 to 6 hours. If you cannot keep down liquids, you need to seek emergency medical treatment, because you can easily get dehydrated. If you lose more than 5 pounds with your illness and you're diabetic, you need to seek emergency medical treatment. If your blood sugar is less than 60, you need to seek emergency treatment. In addition to that, if you've had a fever of greater than 101 for more than 24 hours, you need to seek emergency medical treatment. And in addition to that, obviously, if you're becoming sleepy and kind of hard to express yourself, or any kind of neurological symptoms that could be a sign that your blood sugar is going low, you definitely need to seek emergency medical treatment. So just went over a few of those things. And again, those are the recommendations that were made by the CDC just this week in an attempt to try and help patients that are diabetics, have asthma, as well as heart disease, to help know, okay, now I need to seek emergency medical treatment, or this is what I should do to try and prevent myself from even needing to seek treatment. And definitely staying on your regular maintenance medications and regimen as prescribed by your physician is definitely something that will help you with that. So lastly, what I'd like to do is for us to just kind of go over some pharmacy considerations. And so I think this will be very helpful, because some of you out there, if you are someone that has to take medicines on a regular basis and have to visit your pharmacy, you may not have been to the pharmacy recently because we've been quarantined or at a stay-at-home order. So pharmacy considerations. Now, the new guidelines are, pharmacy-wise, is that everyone that enters a pharmacy must wear a mask or some kind of facial covering. That's the first thing. Unless you're less than 2 years old, unless you're obviously unconscious or incapacitated. If you're someone that's having trouble breathing, we definitely don't want you to come on with a face covering. In addition to that, what you'll notice is most of the pharmacists and pharmacy techs will have on a mask. Don't let that be alarming. They deal with people all day and having to deal with people in the realm of trying to keep that 6 feet distance, because in actuality, that's the strongest tool that we have to fight COVID-19 is doing that social distancing. That's the only thing that we know for absolute certainty, is that social distancing has made a way to help us start to flatten the curve. So Pharmacists may have on a mask, pharmacy techs may have on a mask. Don't let this scare you. If you have regularly scheduled immunizations, you may likely need those to be rescheduled. Don't let that alarm you. We just want to get it rescheduled because you have to be in that close contact in order to get those immunizations. So if we can put those off, we'd like to put those off. Contact your physician to find out if that's something that you need to do. In addition to that, they're encouraging physicians and nurse practitioners to make sure that they're prescribing medicines electronically when you can and by phone, because we don't want people to have to handle paper if we can avoid it. As that's a way that COVID-19 can be transmitted. In addition to that, when you get there, they may put your medicines on the counter and not actually hand them directly to you. I encourage you to please keep that in mind, that the reason that they're doing that is trying to keep in touch with the social distancing and that 6 feet apart rule, and to not handle some of the same things that other people handle in an attempt to help decrease or mitigate the risk of spread. So that's all that I have to share with you guys today. Again, the strongest piece of information we have is that we know that the social distancing works. I know that there's been a lot of talk in the media about whether or not to reopen things or not reopen things, or whether people should repopulate. At this point, I definitely, in taking care of a lot of patients that I'm taking care of, am not recommending people to go out at this point. And that everyone continue the social distancing, because in the last 4 to 6 weeks that we've been doing this, we've actually made a little bit of headway. You won't see the numbers or the effects of what we've done right now, though, until 2 weeks later. So we're starting to see a little bit of sunlight at the end of the tunnel, but we are not out of this by far. So I encourage you, and I'm not recommending my patients to start to repopulate with society at this point, because we all do need to use the strongest weapon we have. And the 2 strongest weapons we have is the social distancing and the hope that we have and belief that this will be over, and that we can come together as a community to help mitigate and decrease the risk of spread, stop the spread of COVID-19, and continue to live healthy lives and not live in a state of fear or panic or fright or anxiety or worry or in alienation and loneliness. And I know that's hard to do. I can see that my mom and my sister are watching Jada and Rabia and my mom, who I miss them terribly, and the kids. And so I empathize with all of you that are out there that, you miss your families. This is something very unprecedented that's going on right now with COVID-19. And so even though we miss them, loving them right now means staying away from them. And so I encourage you guys to continue to do that. You want to make sure you wash your hands. We're going to wait and continue to social distance. You may notice that there are barriers when you go out now at grocery stores, at pharmacies, in different places. The purpose of that barrier is to keep a level of separation between yourself as a consumer and the people that work there. I know that you guys may have seen in the headlines, there are a lot of people that are grocery workers and different people that work on the front line, including our pharmacists and our pharmacy techs that are at work, just like we are on the front lines doing things every day to make sure that everything keeps going and that we get to a point of wellness and health and empowerment again. And in an effort to try and support them, I would just encourage you to continue to keep that 6 feet distance and staying behind that plexiglass or barrier. You want to make sure that you follow. A lot of the stores are taped now to show you the 6 feet distancing. I encourage you to follow that. If you're in a situation when you're out and someone is not following that, it's nothing wrong with politely just stepping back to give yourself just a few feet so that you still are able to follow that 6 feet social distancing, because I can't impress upon you enough how important that is. So thanks for tuning in today, guys. Thanks so much for watching. Hi, Natasha. My BFF is watching. Hi, Miss Barnes. Thank you for watching. Hi, Miss Taylor. Thank you for Dr. Young. We went to school together. How are you, Dr. Young? Thank you so much for watching. Praying for your safety on the front lines out there. Hi, Miss Jones. Thank you so much for watching. Hi, Beverly. Thank you so much for watching. Hi, my son, Michelle Owens. Hi. Thank you so much for watching. Dr. Owens. Hi, Sarah Moore. How are you? And hi, Sabrina. Thank you so much for watching. Hi, Miss Black. Thank you for watching. And Mr. Barker, Jerome Barker, thank you so much for watching. And Miss Jones, Dr. Jaquel, Miss Payne, and Miss Bush, thank you so much for joining us today. I'd like you guys to go out and feel empowered. We're all in this together. We're all alone together, and we're flattening the curve through our social distancing. So we're feeling empowered and feeling very hopeful. My aunt actually shared a good word today about hope and how strong of a value and a tool that hope can be in help fighting fear and anxiety and stress that seems to be surrounding a lot of people right now. But it's very important for us to stay strong mentally and to not give in to that, and knowing that we can all get through this together, alone together, but that our biggest tool in fighting this is the social distancing. So with that, ladies and gentlemen, have a wonderful Friday night. Thank you all so much for joining. Hi, Mr. Johnson. That's one of my patients. Mr. Johnson, hi, how are you? And thank you so much, Miss Tate. Oh, thank you so much. You're so sweet. So you guys have a good Friday night, and we will talk with you guys on Sunday. We'll have our regular Let's Chat Sunday at 3 p.m. Central Standard Time. Everybody stay safe. Bye-bye.